On the return to school, there does seem to be some increasing skepticism that a full return is going to happen. The head of the Superintendents Association told me the other day that there's a general consensus among superintendents that the hybrid of remote and in-person is the most realistic and feasible way to go, given the restrictions with busing and social distancing. And then you have parents and teachers who are just worried, and I know you said there's misinformation, but they might just be worried no matter what. How do you address both of those things? And would you order a district to go with a plan that they didn't really want to go with?
Okay, so there's a lot there. I'm going to answer it, and I want to give the commissioner a chance. So the worry, how do you deal with the worry? That's exactly why I'm planning to increase my communication about it. So this is, right now it's a lot of worry, legitimate, but it's just a lot of unanswered questions. How do you do this? How are you going to handle that? What if, what if, what if? So that's why I've decided, starting tomorrow, every Thursday, we're going to talk about different issues. And I think it is my hope that once parents start to hear from pediatricians, teachers, mental health experts, once we start sharing details around how this is working in other countries, how you can do it. You know, even some of the basics, Brian, like a picture. We learned that when we were doing opening of hair salons. The pictures really help. So anyway, for the worry, I want to spend the next 6 weeks really increasing information that we share and giving people answers to their questions. You know, like they're asking legitimate questions. How are you going to do testing? We are going to give them answers. Secondly, I don't think the superintendents should say that so quickly. There's a lot more work to be done. So many of the plans we received were excellent. Others of the plans, there's more work to do. And it's not okay in mid-July to say we can't figure it out. It's okay to say it's hard and we haven't yet figured it out, but we need to see some more work around the unanswered questions, and also we need to do our work. Right? So if they're worried about transportation, what more can the state do? Some of its resources, some of its planning. I do know this. It's wrong to just say it's safer to keep kids at home, because I don't know that that's true. Our children are suffering. Nutritionally, they're suffering. Intellectually, they're suffering. Emotionally, they're suffering. Mental health issues are through the roof. Immunizations are down. And to be very honest, this is an equity issue. I worry most about our children kids who live in poverty, who distance learning, it was a real challenge. So it's way too early to throw in the towel. What everybody needs to be saying now is, how can I find answers so that kids are safer in school? It is safer to return them to school because they get all the intellectual, educational, emotional, nutritional benefits of being in school, and we've taken enough precautions so that they can be safe from the virus. To those superintendents, I would say, let's keep working. We got to keep working.
Would you order them if you said full return in mid-August or whenever you make the decision, and they're like, no, our full return is a hybrid?
We're not there yet. I'm not there yet. Look, right now everything's on the table, and we have to look into what our authorities are. So it's July 20th, or whatever date it is.
But it sounds like you're full speed ahead to go full in person, while they're saying that may not be practical.
What I'm saying is, I don't know yet, because there's more work to be done. So to put down I think what they're saying is, this is hard, and they haven't figured it out yet how they can do in person. And I'm not yet convinced that we've done enough work to come to that conclusion. Does that make sense? And
if I may just, the testing component. You said more people can get tested, but I know it was months ago. You said your hope was that 20,000 people could get tested by the time school rolls around.
Yeah.
And that would be the capacity. What's the plan there, especially when you have these delays that you've acknowledged and kind of like not getting maybe the real-time picture of what's happening?
So what we are trying to do right now is set up a plan where we can have a whole separate rapid testing process for schools. And again, this is real time. We are right now, quite literally, I spent last night, like right now, trying to procure the equipment we need so that we can do rapid testing at every school, so that on top of that we can do surveillance testing for teachers and kids. So we need a little bit more time. I don't think of it so much anymore as a number, you know, like you were saying, 20,000 a day. I think of it as, can we do rapid testing for every kid in every school and give us what we think of as like actionable data, enough data so we can take action on it quickly. Can you answer this? I just want to give the commissioner a minute because.
So just to add to that, I think the governor answered the question well, but that's why we're planning, right? That's why we have the 4 scenarios. It would be irresponsible on our part not to plan, not to try to figure out the hard decisions. I think that we have, or I know that we have been leaders as a state, the governor, Dr. Alexander-Scott, in how we have tackled COVID, and even in education. What we're doing is going through the exercise of what we can have in place. What are the things that we're putting in place? And part of that process is listening to the community. All the plans required that the districts listen to the community. What would make you feel safer? What are the things that you want to see in place? That's all on the table, but we are not ready to say we're not going back in person, we're doing this, we're doing that. We're planning. It's the most responsible thing to do.
Commissioner, can you address two exact quotes that are attributed to you from that Zoom call last night that were posted? One is, he is a principal or a dean of students at Gilbert Stewart Middle School. He says on the Zoom call, it was stated that if Rhode Island schools were to fully reopen with current infection and death rates, 250 students and 450 teachers would die. Is that true?
That he said that?
That was said on the Zoom call. He's quoting it from the Zoom call. From
No,
yesterday.
that was not said. That was not said. So there was a lot of information last night that was not said. There were quotes that were not said. And just so that you know, it's all recorded.
Okay.
So
this is someone putting it out on social media.
Well, it's unfortunate.
Quoting it. The other one is this group, Rhode Island Parents Educators for Safe Schools. The person that runs that group on Facebook, they have over 10,000 members. She claims, she's an educator and she has a child, I guess. She claims Commissioner of Education, Infante-Green, said they know some people will die. Is that true? Did that happen? I
never said that. Like I said, so here's the problem.
But these are educators saying.
Well, then that's a problem, right? That in and of itself is a problem. We heard the governor talk about fear-mongering. That, to me, I should actually look into suing them. I didn't say that. I would never say that. I'm a mother of 2 kids. We went out. We were the first state to go out, guys. You got to trust that we're going to do the right thing. You heard the governor say, numbers matter, science matter. We went out first. We have been ahead of the curve. So that is very irresponsible, and I'm sorry that a teacher would do that. That is very irresponsible. So if any of you want to hear the truth, go listen to it. It's all recorded.
Commissioner, but is it reasonable to expect that buildings that were just one step short of being condemned a year ago by the Johns Hopkins study are going to, in 37 days, be capable of safely maintaining in-person education without necessary adaptations to ventilation, or in some cases, even basic structure? Is that reasonable to believe?
So I think we have to look at the plan, right? Because the plan is talking about retrofitting some things. So last night we heard a lot of comments that it was clear to me they had not read the plan. There's a lot of things, even before I came here, I had a call with the superintendent, with the team. It's going to cost $400,000 to do that. We're going to do that to get the filters. So we are looking at solutions. If we're already putting barriers in front of what we're going to do, then we should all stay home. Well, I have to tell you, that we are going to find solutions. If the building is not adequate, we will not use that building. We will use another building. We are coming up with what would be the safest option. That's what we're doing.
Well, one of the suggestions, according to the plan, are these pods. And if, in fact, while the pods are being utilized, are a safe way of conducting class, ultimately, it's, again, common sense. Those people will leave those pods and interface with the community at large. In many cases, in the urban core, where you've got a condensed population. So then those folks will return to the pods. Overwhelmingly, there's social media groups which are comprising 5,000 and 6,000 people, Rhode Islanders, teachers, who are demanding that in-person be pushed off until adequate time can be had to consider the consequences. That, in fact, we have to go back to some type of distance learning module if immediately.
So I'm just going to quote the governor. We're not there yet. What we are doing is planning. Nobody has said we're going to do one thing or another. We have asked for 4 plans. That's what responsible people do. They plan. Right? We move forward with the plan. Nobody's saying we're going to do one thing or another. We're going to work out the kinks. We're going to figure it out. As day to day, we are glued to the hip. There's nothing that we're doing or putting out that the Department of Health has not seen, approved, or helped develop. So I want us to be very clear. We have not said one thing or another, but you should feel good that we're planning for all eventualities. Everyone. I understand what some people's desire is. I get that. But what do I say to the mother who emails me and says, my kid did not benefit and needs to be in school in September? I have to be responsive to everyone, and I work with everyone, and we are going to do the right thing.
Will you suspend RIDEcast? And last question, is RIDE ready for either organized or, in the old days, they would call them wildcat job actions?
I don't know what those wildcat job actions are. I would hope not, because during a pandemic, I think that would be unfortunate.
It's being discussed openly.
Well, it's unfortunate. It really is unfortunate when we have families going through very difficult situations. And I would hope that we don't get there. And I would hope that if you're listening as a parent, that you're hearing that we're planning for every situation. No one has said we're going to do A, B, or C. What we are saying is this is what will happen during A, B, or C. I would be worried if I were in a state that we didn't have a plan. And I have to tell you that there are places where there are no plans. So we are trying to do the best with the information that we get day by day. And I need you to know that we are not going to put anyone at risk. We are going to do the right thing as we have done. You have seen the leadership. Why would we do anything different in our schools?
Going to a real basic question here. The governor just said, you'll be safer in school than not in school. At the same time, Dr. Alexander-Scott said a group of 30 people is too many and is unsafe. Understanding the unknowns, understanding the differences between adult and pediatric situations with this virus, how do you square those two statements to the general public that says, look, if we're going to be in a classroom with 30 people, the doctor says that's unsafe in general? What's just a real basic question outside of any planning or anything like that?
I'll let the doctor answer that.
It's an excellent question. It's where we are putting together the science and the data. What we're doing differently in this scenario is really creating that space for stable groups, using assigned seating, limiting the movement of students throughout the school, working more so with creativity and engaging the teachers so that the students can stay in stable groups. That's what the key is, in addition to all of the supportive measures that we're talking about working. Masks where developmentally appropriate and able to use, hand sanitizer on a regular basis, distancing or positioning children creatively where we can minimize the exposure that exists. On top of that, we do see that with children, the spread of COVID is different. Thankfully, children are not impacted as significantly as a frail elderly adult or someone with underlying illnesses. Increasing data is showing that children are less likely to be vectors spreading disease. All of that information we're continuing to collect systematically and use to directly inform recommendations on how we go forward. But that's specifically how we're able to reconcile the groups that I referred to earlier of gatherings, where I was saying people are mixing, they're not wearing masks, they're not distancing, they're not sanitizing, and it's involving more so adults that we are seeing impacted. In this situation, children, stable groups, assigned seating approaches, working with the same staff, masking where developmentally appropriate, hand sanitizer. Those are approaches that we're taking to keep people as safe as possible.
We just heard from the governor and the commissioner that they're going to wait to see what the best option is. But can you address if you've already decided whether you think that in-school learning is the best option?
I will repeat what the governor said, which we all agree on fully. The in-person schooling does provide safer opportunities for children when you look comprehensively at what children need. And it's our responsibility from a health and public health standpoint to help take that entire perspective into place. We absolutely want to keep them and the staff safe in a COVID-free environment. We also want to help support the educational attainment that's necessary for the children, the nutritional attainment that's necessary, the emotional and mental health well-being that's necessary. If you talk to the children, they're missing that engagement with each other that contributes to their appropriate developmental advancement. That comprehensive picture is what we are taking into account and aiming for having the safer, appropriate place possible and planning for all possibilities.
Are you able to say directly, though, that this is the best option? Because you've been quoted today in other news outlets saying that you do believe that this is the best option. So what is your standpoint? Can you say that right now for certain?
With being able to account for all that we are discussing, children being in person in school is the best option.
I'd like to answer that. So, I'm not sure what the real question is. I mean, yes, in a vacuum, children learn better in school. I would say that as a fact. I'd also like to say it's mid-July. We don't really know what life in Rhode Island will look like August 31st, which is why in most of my comments today I said, hey, we got to keep a lid on this virus. And this is all going to be dependent. You asked a question, Brian, about communities. Obviously, if a particular community has a test positive rate of 12%, well, that's a very different situation than a community that has a test positive rate of 1%. So what's the point here? This is probably one of the biggest decision we'll make. Our children's future depends on it. We don't know now exactly what life is going to look like in September, October, November. Yes, in-person learning is best for these kids. So we want to drive towards that and see under what set of circumstances could we have in-person learning such that kids are safer in school, which means different transportation, different air filtration, mask wearing, stable groups, etc. But we have to be flexible. We know also right now there's going to be some amount of virtual distance learning next year. We know that. We just do. Kids are not going to be allowed to go to school sick, period, full stop. There's going to be outbreaks. We will have to be flexible. So the point we're trying to make now is, as hard as it is, we can't say today with certainty exactly what the plan is. We need a plan for how to deliver school safely, fully in person, a plan for a hybrid model, and a plan for a fully virtual model, so that we can be ready for whatever this virus throws us.
Governor Doctor, in regards to the 113 false positive tests, how can you reassure the people of Rhode Island that the result they are getting is in fact the correct one, and how will this impact testing moving forward here in the state?
Thank you for that. It allows me to share that last week, one of the out-of-state labs that runs tests for us let us know about 100 false positive tests. That means that roughly 100 people were told between July 9th and July 14th that they were positive when they were really negative. We communicated that to all the people affected about that issue, and it changed our case numbers, decreasing them for the days between July 9th and July 14th. What we can say is this is why we are building that in-state capacity that we are talking about. The standard that our state health laboratory, the Rhode Island Department of Health, has provided, that our colleagues with the Lifespan laboratories, and those that we are building the infrastructure for within state, allows us to have the confidence, both in terms of the turnaround test and the validity of the tests for people who are getting tested. Sometimes those unfortunate mistakes can happen, but Rhode Islanders can be assured that we have a vigilant team, both within our state health laboratories and the partners that we are building with us, to minimize the number of times that any of those types of challenges occur.
And while I have you, of the deaths over the past week, are they among the younger population, older population?
The unfortunate deaths continue to be in the older population, those who have underlying illness or those who are more senior in age.
Governor, on the
Governor, I'd like to shift gears just a minute. After your announcement last week, I heard from a lot of small businesses who were underwhelmed by the proposal. And I had one gentleman write me, he said he watched the Facebook Live that you did with the congressional delegation, and he described it as basically 6 people who haven't lost a paycheck, the majority who have never run a small business, spending 30 minutes congratulating each other about what a great job you're all doing. And he particularly took issue with your phrase, sense of urgency, which you have used many times when you're talking about small business. 8 weeks ago today, I asked you about this. You said, we're looking at it, we're not quite sure. A week ago, it turned out that it's going to be 6 weeks before it gets out the door. So how can you, with a straight face, continue to use the phrase, sense of urgency, when small businesses are dying on the vine?
Yeah. So I don't think it'll be 6 weeks, by the way. I'm not sure where you get that, but because
a week ago, 2 weeks for the application, and then
a
your
couple
Commerce
more
Secretary
weeks,
said
yeah.
another month. So
Fair
5
enough.
weeks from today.
Yeah. So listen, I'm not surprised they're underwhelmed because, as I said last week, it's barely a drop in the bucket. It's also not the only thing we've done. You know, $2.5 billion of PPP loans, which we have worked very hard to get into the hands of businesses in Rhode Island. Many of them didn't have a banking relationship. Many of them didn't know how to access it. So that is something we've done. We've done technical assistance. We passed out 500 computers. We got free cleaning supplies, helping with plexiglass. The brutal reality is we are working with urgency. We've put billions of dollars and lots of technical support out there. Everyone who calls the 521 helpline gets a call back within a day. We've done reopening RI. We're providing lots of technical assistance, and also these guys are still struggling, which I'm hugely sympathetic to. So I get that. Look, I actually was in business. I started a business. I ran a business. I get it, and I hear him. So I think both are true. We're trying hard. We're working hard. And it's just not enough.
But for example, so sole proprietors, I have no idea, they don't know why they're not eligible for this plan. And it seems that the government is trying to say, we know better than you do, small business, what is good for you and what you need this money for. And in certain places they may not qualify, but they may need money for something else that you guys aren't seeing.
Yeah, it isn't that. It's just that we have this much money to fill this much need. And so we're trying to do our best to parcel it out to businesses that are viable, get it out the door quickly. They're lump sum payments and grants. Here's the reality. But even the best restaurants now, like they're reopening, they have a good business, they're big, they're at 60–70% of where they were. That's just because we had to close businesses. So of course they're angry. I'd be angry too. To think that a small loan program or grant program is going to meaningfully make that better, it isn't. So what actually the best thing I can do as their governor is get this economy going again, which is why I'm up here saying wear your damn mask, follow the rules, knock it off with the big parties so we can get everybody back to work. and doing our inspections. The real thing we need to do is get this economy going.
So final question, you said 50 million is the floor, not the ceiling.
Yes, it's the beginning.
A week ago. So why not just say, do the 100 or 125 million and not roll it out and like it's like Chinese water torture?
Well, we do have other competing needs. And, you know, look, in a given day,
The competing need is the budget hole that you cannot
the
use that
competing
money
needs
for.
are nursing homes, our hospitals, our folks who need PPE, our schools who need money to reopen, our hotels that may want to go under, our nonprofit cultural operations like this one who haven't been open. The needs are massive, which is why I've spent all morning talking to Republican governors to lean on their Republican senators to get Congress to do the right thing and send some more aid. So I would say we absolutely are working with urgency. We were among the first states to put out a lot of the aid that I have said. I mean, look, most governors haven't done any of these small business aid yet. I think 10 or 11 of us have. We got Microsoft to give away 500 computers. We had technical assistance. But I'm no way denying that person's pain because this is awful. So I just got to stay at it. I stay at it every day. Going to have to give schools some money, hospitals some money. We got to get through it slowly, and hopefully they continue with. I know they're talking about a continuation of the PPP program in Congress. They're talking about big aid for small businesses in retail, hospitality, and restaurants. So we just got to hang on there. We got to hang in there.
Governor, on the nursing homes.
Just a moment.
Got Brian, and then
So, on the nursing homes, there's a couple workers at a couple nursing homes have talked about striking over staffing issues. What's your thought on that? And then also on the testing, back on the testing delays, does that kind of make your travel restriction kind of pointless for people to get a result before they come if the results aren't coming for a week to 10 days to be able to travel when you don't know what your results are going to be? And other states like Maine have required like hotels and Airbnbs to get your test result to you to show a proof. And you know the governor in Connecticut is issuing like a significant fine for people who break quarantine. Are you thinking about any more of that with the travel restrictions and, sorry, the nursing homes too?
okay. So you forgot the first one. Okay, so the first question is nursing homes. This is another tough one. These are all tough questions. Let me say this. I appreciate the frustrations of folks working in nursing homes. And the people who are considering going on strike have some of the toughest jobs. You know, nurses' assistants, custodians, folks that work in the dining hall, folks that clean the rooms. It's really tough the way that they have had to work through the thick of this. And I am hugely sympathetic to their desire for minimum staffing. Having said that, now is not the time to go on strike. We really need you, and we have thousands of Rhode Islanders in nursing homes who deserve to be well cared for in the middle of a public health crisis that's hitting nursing homes the hardest. I am a supporter of the minimum staffing bill that they were advocating for. I was disappointed that it didn't get through the legislature. I guess it passed in the Senate, got held up in the House. I'm hopeful the legislature will reconsider that and send me a bill. And in the meantime, my administration has reached out to the SEIU to ask them to hold on the strike, and is there anything we can do to try to avoid a strike? Their requests for better staffing, I think, are reasonable, and we ought to try harder to meet them there. So we're going to work hard on that. At the same time, I'm asking them, please don't strike, because, listen, we're in the middle of a crisis and nursing homes are the hardest hit.
Sorry, the travel thing with the test results. People are finding it hard to travel when they can't get their test results for a long time when you're supposed to have a result within 72 hours. Should I go on a trip to go see family somewhere else? And that Rhode Island doesn't really...
She seems chomping at the bit.
Yeah, and that Rhode Island doesn't really, you don't need to offer any proof anywhere, right? It's on the honor system. Is there...
Okay, you answer this. That's not true.
So there are a few dynamics that I wanted to clarify as part of your question. For people who are not from Rhode Island, when they travel here, particularly from a state where the test positive rate, the positive percent is higher than 5%, they need to quarantine when they arrive here. And there is an exception that they can show proof of a test that they obtained in their home state within 72 hours prior to arrival here. So that's for those who are tourists. The preferred approach is to quarantine and monitor for symptoms, but that test is an exception. Similarly, if there is a Rhode Islander who travels to a place where the test percent positivity level is more than 5%, when they return, they should quarantine as a way to go forward, or they can obtain a test in the state where they are leaving from for the 72 hours prior to returning, or when they arrive back, they can also obtain a test as well by going to the self-scheduling portal, portal.ri.gov. During the time frame of waiting for the results, it's a time when we want people to monitor themselves for symptoms, which is what the quarantining preference is for. But the test is an opportunity to do as an exception in some rare situations.
There seems to be a lot of frustration of people who may want to go somewhere for 3 or 4 days or a week, but they know they're not going to get their test results leaving Rhode Island for possibly 5, 6, 7 days or a week, and they have to cancel their trip.
They can still go. Yeah. They can still go on that trip. It's when they return, which is where the quarantining or the exception of the testing can be done. They can either get the test within 72 hours prior to them returning, if they have that result that shows that they're negative, or once they return to Rhode Island, they can get the test as well, with the key being stay local, monitor yourself for symptoms, particularly during the 14 days upon returning.
Governor Charlie Baker.
But I think there's a frustration, maybe it's not the rule, but there's a frustration among people who want to go somewhere, right? So the other state may require a test from Rhode Island, like Rhode Island requires a test from another state. But if I get a test in Rhode Island to go somewhere else, and I can't get the results for a week, and I don't want to quarantine because I have to go back to work, they want to follow the rules, and they don't want to quarantine when they come back. They want to do it by getting a test. But the test delays are making that an encumbrance to be able to do it.
Reduce the delay.
Yeah.
But you can leave without getting a test. Sorry, I'm just saying, you can leave, you can go wherever you want without getting a test. And you can come home and get a test. You just have to quarantine until you get your results. And we need to do a better job cutting down the time. I mean, that's like, we're on it.
Governor Charlie Baker.
He hasn't had a chance.
I wanted to switch gears a moment. There's been a lot of attention to the situation in Portland, Oregon, where federal agents, without identifying agency emblems or name tags, are dressing in camouflage and, according to reports, are arresting people without charge or horrible cause. And that this has been confirmed now by a number of people, including Homeland Security officials. And the president has now said that he intends to carry out similar actions in other cities, and his words were those places controlled by Democratic governors or mayors. And apparently the Chicago Tribune has reported that there are 150 similar federal agents planning to be deployed to Chicago, and there are rumors about similar things in Philadelphia. And obviously Rhode Island and Providence would qualify as places that have a Democratic governor and Democratic mayor. There are even lawsuits in Oregon about this to try to stop it. And practical concerns, such as if they don't coordinate with local law enforcement, could the Providence police and the federal agents end up in a shooting match? And of course, my experience of Providence, and I think your experience of Providence right now, is that we don't exactly have rioting in the streets here, or any particular reason to have armed people on the streets like that.
Right.
So I'm curious what your take on this is, what your response is, and whether you have considered that issue and what you would do about it if it did.
Yeah. So I think it is a wrong-headed policy on behalf of the president. and clearly politically motivated more than it is out of desire to protect people. Not entirely different than his edict that undocumented immigrants can't be counted in the census. It's all part of a political strategy around fear-mongering, which I oppose and wish he would spend more time focused on doing his job and actually helping states to meet the needs of the crisis. Having said that, as you said, here in Rhode Island, we have a peaceful situation, and there isn't any reason even Trump could justify coming here. Were he to, I would use all tools in my toolbox to oppose it. And I haven't yet investigated what those tools would be, lawsuit included. But the point of it is, it's not necessary, it's not helpful, it doesn't make anyone any safer. And I would have to look into every way that I could oppose that, because I think it would only endanger the lives of people in Rhode Island.
The moratorium on evictions in Massachusetts was extended today by Governor Baker to October. Any thoughts?
Yeah.
You haven't had a moratorium per se.
I haven't, right. So I did see that, and I was interested in seeing that. A week ago.
Can you do that?
Well, so let me answer. So a week ago, I did the mediation program. We're doing that voluntary, hoping to help people stay in their homes, and I dedicated CARES Act to doing that so folks could pay their rent to stay in their home. I would need the legislature to pass a law to essentially give me the authority to do that moratorium. That's what happened in Massachusetts. The Massachusetts legislature, via law, granted that authority to the governor. I would absolutely welcome that authority. We looked into it, the possibility of using my executive authority under Title IX, and I didn't think it was possible. But I would encourage the legislature to look at what Massachusetts did, because I think in light of what could be coming our way in terms of evictions, it's absolutely something I would look into.
Week into it, what can you tell us about this mediation program?
Not much yet. Not much yet.
Just really quickly, while we have the commissioner here, because we heard from you and Dr. Alexander-Scott before saying full certainty that although you're still looking for an exact plan, you do believe that in classroom is the best. But a lot of, if we can just hear, are you on that same page right now? Can you say with full certainty? You mentioned you're looking at the data, but are you at that same page where you can say with full certainty that in-class learning is the best option right now?
We are planning for all the options, right? We all know that kids benefit from being in school with their teachers. We all know that. So that's why we're planning for all the options. And what we're trying to do is remove any of the obstacles so we can get there safely. We have not said we're going to do one thing or another, but we have the responsibility of doing the hard work. And it is hard work, and we've been doing it almost 24 hours a day. So yes, we would like kids to be back in school. Absolutely. Those of you that have children know how hard it is.
Commissioner, I was assured a month ago that Rhode was formally assessing the effectiveness of distance learning. And it would be extremely helpful, I would think, to have that result now to guide local school departments and parents in making their evaluations of what the cost would be in terms of educational quality and outcome from distance learning. What can you tell us about that formal assessment and when it will be available if it isn't done yet?
Yeah, no, it hasn't been done yet. The kids are out now, but we will be doing that in the fall. So we have a better idea of what it looks like, what gaps, if there are any, what we need to supplement, how we need to support the students as we move forward. So we will have that because we don't have one test that cuts across the entire state. But we are putting out an RFP to get that so that we have that ready in the fall. Because we know that things are going to be different, right? We know that. Even if the vaccine is developed tomorrow, education is different after this. So we want to know how effective, what we can supplement, but we do know that a lot of kids have struggled, and we want to be able to say, so now we're going to supply X, Y, and Z to make sure that our kids get what they deserve.
Will you cancel Right Pass given the time and the financial?
I don't have the ability to cancel RIDECast. If it is an option and we see how things go, it is too premature to say that.
When will we have an update on fall sports?
On what? On fall sports?
If you had any contact with interschool, I know some of the wheels are in motion. I've been hearing from referees, coaches that are planning. As of right now, they're on. Even just in the next couple of weeks, are we looking at that time frame?
Let me get through the plans to get back to school. We are having conversations, but as you hear, there's a lot of trepidation, right? And there's a lot of things that we need to make clear, and we need to get information out so that everybody makes informed decisions. So all we're doing is planning. I need everybody to walk away from here to understand that we are planning for all situations. Thank you.
Thanks.